We all learnt about how babies are made during our school days, and we await the day when we become parents patiently. We finish our studies, get a job, find a girl of our dreams, and get married. Then it's time to start a family. Shouldn't be a problem, right? But it doesn't turn out as how we had it planned. Now, usually, the woman goes in for all sorts of checks, and when everything is clear and it seems alright, the man goes in and get checked. How did we end up in this situation? What are we going to check for? And if something is not right, how do we fix it? What options are available for couples with infertility problems? All this will be discussed with my special guest today. He's a gynecologist and fertility doctor. He offers a detailed assessment of couples trying to get pregnant and individualizes treatment plan to shorten time to pregnancy. With over 15 years in the discipline of obstetrics and gynecology, he is competent in all aspects of this field. He has been looking after patients in several major hospitals, namely Hospital Besar Melaka, Hospital Tengku Ampuan Rahimah in Klang, University Malaya Medical Centre UMMC, and Hospital Sungai Buloh. His experience in looking after high-risk pregnancies, such as twin pregnancies, mothers with medical problems, and preterm deliveries. He's skillful in performing scans for baby's growth and detecting abnormalities. His interest in reproductive medicine, a specialized field in gynecology, started after personally witnessing his close family members facing difficulties conceiving. He shares the joy parents get whenever they hear the baby's heartbeat for the first time and taking them through till delivery of their special bundle of joy. And it's our joy and pleasure to have him on the show today. So if you're ready, it's time to man up with Dr. Chong Kuoh Ren. Hi, Dr. Chong, how are you?
Hi, Kevin. How are you? Yeah, thanks for inviting me for this podcast interview.
I'm very well, thank you, and thank you for being on the show, Dr. Chong. Now, Doc, male infertility seems to be more common than most men would think. In my experience, I'm 44 years old, I've been married for 6 years, and my wife and I are still not successful in getting a kid. To me, it looks like more men are having issues with having difficulty to help their partner conceive. Dr. Chong, how common is male infertility?
Well, infertility in my field is definitely a very common thing that happens. So especially this, I would gather, it's due to lifestyle changes. Because as our society progresses, we study more, we work more, and we tie the knot late. Okay, so on average, I think probably among your peers as well, that they get married, they start to think about dating in the early 30s, spend a few years having romances, then only you tie the knot. After the tie knot, of course, you still want to work, especially both couples. You want to climb the corporate ladder, you want to be successful. You want to have enough money in the bank before you think about getting pregnant. So this is a very common scenario. And when everybody's ready, probably couples are usually in their late 30s, where they're financially doing better, but then when it comes to really getting on to starting a family, then the problems will start to appear.
Dr. Chong, we hear about women having a biological clock. What about men? Do we have a biological clock?
Yes, the answer is definitely yes. The biological clock simply means aging, because we keep on aging, and the effect of aging is of course on the testes, whereby the testes is older testes, is not as young as somebody who is 20 years old, where everything is good, everybody is healthy. So with age, the function of the testes, especially in sperm production, will drop as well. Of course, the biological clock in men are not as bad as in ladies. Ladies, once they hit 30 and 35 years old, the egg quality starts dropping really fast. Whereas in males, sometimes you hear of older gentlemen, 50s or 60s, they marry a younger lady and they may still conceive as well. So fortunately for males, the drop is not that drastic, but it does happen.
Yeah, I mean, we hear of people like Mick Jagger still having babies.
Mick Jagger just became a dad again at age 73.
So I think even though his lifestyle may not be that good, but his sperms, fortunately, still work very well.
Yeah. All right, so let's talk about sperms. But before that, maybe we can go through the causes of infertility.
Okay, good. Now, the common causes of infertility, 80% I would put it as the deterioration of the testicle function. Yeah, the testis is where the sperms and the testosterone are made. So a big cause is due to what we call the production issue or the issue with the factory. So we will attribute most of them, a big chunk, due to lifestyle factors. Okay, what do I mean by lifestyle factors? Alcohol consumption, cigarette smoking, sedentary lifestyle. Okay, this will cause big problems. Now, as we know, smoking is a big culprit. And for those who smoke out there, it's not only bad for your health, it's not only cancer causing. Recent studies have confirmed that if a couple and the male smokes, the risk of miscarriages increased by at least 20%. So the lady is healthy, doesn't smoke, but because the husband smokes, 20% increase in miscarriage. So that's actually a big no-no. The other causes will be medical conditions. If the male partner has diabetes, high cholesterol, hypertension, or any health issues, this will also reduce the sperm quality. Okay. Now, moving down the line, sometimes we hear about trauma, previous history of surgery, or trauma to the genitals, especially falls, accidents, infections, for example, mumps. Okay, mumps, I'm sure people have heard of mumps. So you get swelling on the neck, and 30% the virus which causes mumps may attack the testes as well. Okay. Then other infection could be STDs, sexually transmitted disease, whereby there will be inflammation of the male tubes. Right? So when the male tubes gets blocked, okay, this will also cause male infertility. Okay. For men who likes to go to gym, okay, and they use testosterone or steroids or growth hormones to help bulk up, okay, this may be an issue, as if you take external hormones, what it does is the testes may actually shrink and stop working temporarily. So they may bulk up, they may look very muscular and masculine and with all the muscles and all that. But when we check the sperms, the testis is actually atrophied. Yeah? So using testosterone to help with the bodybuilders is not good. It's not good at all. So I would definitely strongly discourage from doing that. Now, as we age, especially men, then there'll be other things like performance issues. So the sperms are okay, but because of stress, long hours of working, lower level of testosterone, and maybe the stress of trying to get pregnant as well, this will also cause performance issues. The rest of them are a bit minor. Sometimes you have genetic causes, which can be ruled out by a simple examination as well.
Well, sometimes, Dr. Chong, when we see those who are having difficulty as something with their sperm, but we see other people who smoke a lot daily. Maybe we talk about obesity, you see someone who's really big and all that, and they can have 4 or 5 children. How do you explain that?
This is a very common, counter excuse or not excuse. I mean, I see a lot of smokers when their sperms are not good and they're smokers. Then this is the first thing to change. For those smokers who have a lot of kids, 3 or 4 kids, then possibly their sperms are fantastic to begin with. So by smoking, their sperms reduce maybe by 50%, but that 50% is enough to get their wives pregnant. Yeah, so if they are not best of health and on top of that they smoke, so that will reduce it even further. If we find that the sperms is having problems, the first thing we need to cut down is definitely to cut down on cigarettes. So
we should go and get our sperms checked, right? What are we checking for?
So the simplest check for males, step 1 is actually to do a seminal fluid analysis. That means the male partner will go to a lab or any fertility clinic and give a sample of the sperms. So our scientists will look at the sperms. They look basically at 3 things. First of all, the concentration of sperms. That is how much sperms you produce every time you release or ejaculate. Second thing we look for is the motility, which looks at how fast are the sperms. Are they strong swimmers or are they very weak swimmers? The third one would be the normal shape of the sperms. Because the sperms are produced in abundance. Every day there are probably around a few 100,000 sperm produced per day. The quality control is not that good. So we are looking for the perfect looking sperms, whether, is it very little, majority of them are bad looking sperms, or, how many percentage are quality, the sperms with normal shapes.
Right. So three things is the quantity, quality, and the shape. What are we aiming for?
Okay, so the sperm, well, we are going to compare it to the WHO criteria. Okay, back in 2010, okay, actually every 10 years or so, the WHO scientists will gather together and they'll discuss about male infertility. So about 12 years back, they managed to recruit 1,900 males, healthy males, whereby their wives got pregnant. So these are male volunteers, and they checked all the sperms. So they gathered all the data together, and they have come up with a minimum requirement for healthy sperms. Yeah, so if you're talking about concentration, every ml of seminal fluid, we want at least 15 million sperms. And motility, we want 30% of the sperms to be actively moving forwards. Okay, we don't want them to be, tired, just moving around, squiggling around, but not moving everywhere. And for the normal looking sperms, or what we call normal morphology, out of 100 sperms, we want at least 4 of them to be perfect looking, meaning the shape is good, the head looks like a bullet, oval in shape, the tail is only one tail, not split into two, or the tail is not too bent sideways or too curly. So that's the minimum requirement that we want.
Once we've done that analysis, then what's the next step? What's the treatment if it's not up to standard?
Okay, so if we look at a sperm test, a male partner comes in, and if the sperm test is normal, okay, everything looks great, the parameters are good, the general advice we will tell them is to continue whatever you're doing, take care of your health. If you're smoking, also do try to cut down, and just take some supplements, antioxidants, for example, vitamin C, vitamin E. All those would help reduce sperm damage. Now, if you see that the sperm is slightly lower than average, not terrible, but maybe lower by 20% or 30%, then we'll go through the history, okay, whether they have a social lifestyle things that we can change, stop smoking, reduce alcohol, don't do recreational drugs. And also we ask them whether they have a sedentary lifestyle or do they do exercise. Okay, if they are overweight, they watch TV 20 hours a day, then they need to get on their feet and work out more. Improve the health, improve blood circulation, and more nutrition will go to the testes, and therefore help improve the quality of the testes, and then the sperms also help improve. We also can give them some treatments or supplements that can boost the function of the testes. Supplements or medication that help the sperms, you need to take them, or somebody needs to take them for at least 2 months to 3 months, 60 to 80 days. If any supplements or medication, you take it only for 2 weeks and you repeat the sperm test, we will not see any major improvements. The reason is the new sperms will take at least 60 to 80 days before a new batch comes out. Okay, it's like the factory, you start the production, if 2 weeks, don't see anything. So we need to be consistent and continue with the supplements for 2 to 3 months.
Now, Doc, one thing that puzzles me is it takes 2 to 3 months to produce the sperm, but at the same time, we are advised to ejaculate every 2 to 3 days to keep the sperm fresh. Maybe you can unpack that a little for my understanding.
Sperms, there is something called DNA fragmentation. DNA fragmentation means that the quality of the DNA in the sperms are not that great. This could be due to aging, this could be due to environmental toxins that are in the body. Yeah? So the more frequently we ejaculate, we are sort of refreshing the sperms. And so we want to get rid of the old sperms so that it also encourages the testes to create new ones. So that is an ongoing process. Yeah? So if you're trying to get pregnant and you know the fertility window, which is the best time for your wife to get pregnant, we will encourage intimacy to be maybe 2 or 3 times per week. It doesn't need to be every day. Yeah? So if you know the window, every alternate days, just try. But what I'm saying about the medication, the treatment, to see any significant results or changes, improvement in the sperm test, that will take 60 to 80 days. But while taking the treatment, please continue trying. Yeah, please continue trying.
What about excessive masturbation? Does that affect the quality of the sperm or quantity?
Well, okay, it depends. If somebody masturbates too much, what it does is it's actually reducing the store of the sperms. So if he does masturbation before the fertile period, and for 2 weeks, then the 15th day, 16th day is time to fertile period to have intimacy with the wife. Then the sperm stores are actually lower down. I suppose when the wife is having her menses, it doesn't matter that much. But when it nears the actual days of fertility period, then excessive masturbation may reduce the sperms on the particular day itself. And there are reports of guys who masturbate too much. Okay, sometimes when they actually physically they need to have intimacy, that also affect their performance because they're conditioned to have masturbation. Then when it comes to the actual deed, because of the stress and all that, then they may find that they have performance issues.
Maybe, Doc, you can go through how is sperm produced? What are the hormones involved to produce sperm?
The production of the sperms is controlled in the brain, okay, by a small organ, a small gland called the hypothalamus. This is like the CPU of the brain, right? So the humans, a lot of our body system, like the thyroid, the kidneys, okay, the testes, are controlled by what we call endocrine system. So this is actually called hormones. So in the brain, we have something called a hypothalamus. This has a lot of sensors, and this will detect the levels of the hormones, whether it's enough or not. So for the testes, which produces mainly sperms and testosterone hormones, which is the male hormones, if the sperms are dropping, okay, the production is low, the testosterone level is going down, the hypothalamus will pick this up, and it will send a signal down the line to another small gland called the pituitary. The pituitary is neighbor to the hypothalamus. So the pituitary acts like a gas pedal in the car. It will send out a signal, okay, to coax the testes to tell them to work faster. It's like, hey, move faster. So the hormone involved is something called LH and FSH. Okay, these two hormones can be measured, can be done by a blood test. So the testis, when it receives the signal, it will try to increase the output more. So if the testes are working well, the sperm production will go up, and also the testosterone level will go up. So one way to check whether is there any problem with the testes is to measure the hormones of the testes, namely which is the testosterone level, whether it's normal or low down. Okay, if the sperms are low and we check the testosterone level is low, that means possibly the testes are not functioning optimally.
Okay, so let me get this straight. We'll have the semen analysis first. That's the first step. And if not, we should go to checking our testosterone.
The semen analysis is not that bad, just marginally lower down. Usually I do not do the hormone level tests. Okay? The reason why we do the hormone level test, if the sperms are very, very low. Okay? It's like 15 million, but instead of 50 million, we get less than 1 million, maybe 0 point something million. Or sometimes 0 sperms found in the fluid. Okay?
Yeah, how does that happen?
So 0 sperms found in fluid, there are two things. Number one is the blockage of the male tubes. This is possibly due to previous infection, like STDs. Chronic infection, STDs like gonorrhea, chlamydia, will block up the tubes. So when the tubes are blocked, the sperms are still being produced, but it can't, reach through. It doesn't go into the ejaculate. Yeah. So the testis is the factory, and the tube called the vas in the males, that is the highway system. Okay. It goes to the prostate. The prostate gland is the one that mix together the seminal fluid, which helps the sperm swims, and also during climax, it helps squeeze and pump the seminal fluid out through the penis into the lady. Somewhere along the line, if the transport system or the highway system is blocked, is obstructed, then the sperms doesn't reach the target. Okay, so in this case, if the tubes are blocked, we check the hormones. The hormone testosterone is normal, and we don't see any sperms in the fluid. Then we have to suspect there's a blockage somewhere.
Can it be genetic?
Yes, it could be genetic. If you are talking about genetic, then usually the problem will be over at the Y chromosome. which is the male-related chromosome. Yeah? So if it's a genetic issue, then we have to see how poor is the sperms. If the sperms are marginally reduced, we can still use traditional methods, treatments to help get pregnancy. But if the sperm quality is really bad, for example, 0 sperms or almost 0 sperms, or the sperms are dead, then we may need to do some genetic tests to see what sort of abnormality is present. So if the testes are no sperms in the fluid, if we can't find any sperms in the fluid, we may need to explore the testes within the testicle itself to look for the sperms. Yeah, this will be done by a urologist. It's not a very easy thing. Yeah, we have to go hunting for the sperms inside the testis itself.
Now, Dr. Chong, let's talk about treatments available for couples who are having trouble getting pregnant.
Apart from changing lifestyle, making sure your health is better, we've tried supplements for a few months and still not getting pregnant, then we can move on to treatments to help the wife get pregnant. So one thing we can do is to take fertility pills. Okay, fertility pills in the wife. Okay, so the reason is to increase the number of eggs that a lady releases per month. So in a natural cycle, every month there's only 1 egg. So when a lady takes 2 fertility pills, she releases maybe 2 or 3 eggs per month. So this will increase the chances of getting pregnant. So every month, if he releases 3 eggs, we are compressing maybe 2 or 3 months down to 1 month. Now, if the sperms are not that great, okay, maybe only about 50%, then we can consider something called IUI, intrauterine insemination. The first step is the same. The wife takes medication, just a scan to see the number of eggs. And on the day of the fertile period, we get the husband's sperms, we process it, we make it concentrated, and put it right into the womb. So this will help, especially if the sperms are slow swimmers or the number of sperms are not as good. Yeah? So this will also help boost the chance of getting pregnant as well. Now, in conditions whereby the sperms are really bad, then we need to do IVF. IVF, it's a bit unfortunate because the problem is with the male side, but the wife has to undergo the treatment of IVF. IVF entails injections, daily injections for about 10 to 12 days to get as many eggs as possible, about 10 to 15 eggs. And then we need to harvest the eggs through a small procedure which is under anesthesia. Then once we get the eggs, let's say 10 to 15, then we get the husband's sample. In IVF, if there are 15 eggs, we only need 15 healthy sperms. Whereas if you're talking about natural pregnancy, we need 10, 15 million sperms to get pregnant. So IVF is also another option for males who can't get pregnant.
So the difference between IUI and IVF would be?
So in IUI, it's not that invasive. Yeah? First of all, the lady just takes some medication, usually about 5 days. If the eggs are not responding well, sometimes we need to give injections or boosters to get more eggs. In the IUI, we just get the sperms from the husband and we put in maybe 20-30 million sperms. Right? In the IVF, after we take out the eggs, okay, we put the sperm and the egg together. So we will observe the embryos growing outside the body for about 5 days. Okay, so for example, let's say we take out about 15 eggs, we get the sperms together, we observe them 5 days. On day 5, maybe half of them survive or grow well, and we will decide how many eggs to put back inside, how many embryos to put back inside. Okay, nowadays we put maybe 1, maximum 2 embryos. Okay, so we put inside, so that's on the 5th day of the cycle. And so that's very restricted, very selective. We put the already formed embryo right into the womb. So the chances of getting pregnant is higher because we already observe, the first 5 days of the growth. But of course, it's much more invasive and takes more time, and the cost is there.
And what about the success rate of IVF?
Okay, if you're comparing with IUI, also maybe natural cycle. Yeah, so couples who have been trying to get pregnant after 1 year and they don't get pregnant. Okay, every month they try, the success rate is about 2 to 5% only. If they get pregnant, then of course they don't need to come and see us. Yeah? But so if they're trying for 1 year and the natural cycle ability to get pregnant is about 5%. So if they take fertility pills, that will push it up to maybe 10-15%. And IUI, the success rate we are looking at maybe 20-25%. So IVF, we are looking between 40 to 60%, depending on a few factors. The ladies' age, if they're less than 35 years old, no major issues. The success rate is 50-60%. Yeah, after the age of 35, because of aging factor, the egg quality drops. Then we're down to maybe 40-45. After 40 years old, the chances drops maybe 30-20% or even less. So IVF is not a cure-all for everything. So there's also a window where it still works. You can't expect ladies to get pregnant at 60, 48 years old, 50 years old. Yeah, not easy.
Talking about age, as we've discussed at the start of the show, couples are marrying later or settling down at a later age, and they keep trying and hoping for a baby, plus that's the pressure. When should a couple stop trying?
It depends. What do you mean by trying? If they're trying naturally at home, if they've been married, they're trying hard for 1 year and nothing's happening, then of course it's time to see a doctor to check what's going on. And if you're talking about results, whether doing IVF repeatedly or doing IUI repeatedly, there's actually no limit when to stop. Okay. Usually couples stop trying. It's because they give up. Number one, because it's very exhausting mentally, okay, as well as physically. They have to go through IVF, they have to come for scans. So that's actually the main issue. Of course, the financial part is there, but most of it is due to the emotional trauma every time they do some treatment and they don't get successful.
Yeah.
There are studies done in overseas whereby fertility treatment is free. Yeah? For example, Scandinavia, Israel, Japan, and all those places, the government actually sponsors fertility treatment. And because the population is going down, then if they don't sponsor them, then the population will drop to zero in the future. So in those places, they actually do not limit fertility treatment. Yeah? So it's limited by their own time, emotional well-being.
Can I ask you, would you recommend TCM alongside treatment?
Well, yes, traditional Chinese medicine, historically they've been around for a few thousand years, right? So I'm sure there's some kind of system that governs the treatment. Yeah? So traditional Chinese medicine, they cover a few things. They have acupuncture, they have massage, they have cupping, moxibustion, they have herbs that you can consume. So how traditional Chinese medicine work is they sort of optimize the health internally in the body. Yeah, so their approach to any diseases is to make sure all the internal organs are running well. Yeah, the liver needs to be running well, the stomach, the kidney, the bladder, all of them needs to be running smoothly. So imagine if you're in a township and the town is full of traffic jam, all the traffic jam and roadblocks are there. So what TCM does is it straightens the roads, it widens the roads, it paves the potholes that you have. They try and patch up all the broken traffic light systems. So TCM smoothen things out, so that the traffic goes smoothly. So that's how the TCM works. They make sure the foundation is good, make sure the basic is good. So together with Western medicine, we give you tablets, then we sort of encourage the sperms to grow. So with the foundation healthy, then of course the Western medicine will work even better. So I'm all for traditional Chinese medicine or TCM. Ayurvedic not so well developed in Malaysia, but I have couples who seek these helps. They take Himalaya products. I'm not sure whether you've heard of them, and I do find that it helps with the sperm quality as well.
So it looks like it's pretty important to take care of our testes. And apart from nutrition and the lifestyle modification that you mentioned earlier, is there any other thing that we should know on how to take care of our balls?
Okay, so a lot of people they seem to think that the testis is it's an independent organ in the body, but it's just like our heart. We need to take care of our heart, like our kidneys. We need to take care of our kidneys. So if you have a healthy body, so the blood supply to the heart, the blood supply to the kidneys are good. So the same thing is, if you are not, we want the blood supply to our testes to be normal as well. So a good indicator of the general health of a male is actually the sperms. Right? So if the sperms are functioning well, it means the blood circulation is good, There's no hypercholesterol, there's no atherosclerosis or blockages in the blood supply to the vessel. So it's actually a good indicator of the general health of the male.
And can we say that about the opposite? That means if something's wrong, just say if I'm having difficulty, male infertility, there could be some other underlying illnesses that I'm probably having?
Yeah. So if we see the sperms are not so good, then we need to start opening our eyes, interrogate the male partner even further. So the usual clues, the usual culprits, of course, apart from lifestyle, is diabetes, high blood pressure, high cholesterol. Okay, these are the normal culprits that we see.
I want to ask about cycling. Cycling has become sort of like a trendy sport these days. I don't know, is it safe? I mean, if someone wants to be a father, should he be going cycling?
So the ideal temperature for the spermatogenesis, which is the sperm reduction, is about 34 degrees Celsius. So that's about 3 or 4 degrees lower than our human core temperature. So that's why in mammals, those of us who've been to the zoos or we have our pets at home, we can notice that the male mammal usually have the testicles slightly lower down. So this is to make sure the temperature is slightly less. When the temperature goes up, 36 or 37, what happens is during the sperm production, we find that there's more DNA problems with the sperms. So cycling, because we mentioned that the production of the sperm is 60 days to 80 days. Now, if you do a lot of cycling, probably those who go outside, they may spend 2 or 3 hours cycling. And so for that duration, 2 or 3 hours, the temperature is slightly on the higher side. If you cycle maybe only 1 or 2 times per month, okay, probably the effect is not that great. But if you cycle every day, constantly, 1 week you cycle 3-4 times, in totality maybe about 5 to 10 hours per week, then it may add up. So apart from cycling, other things related would be tight underwear. Okay, if you wear the briefs or the Superman type of underwear that keeps the testes very close to the body, that also increase the heat. If you like to go for sauna, hot baths for long periods, that also will increase the heat. Some people use laptops. Okay, they put it on their laps, and the laptops gets very warm. That's also a problem. I have known chefs, professional chefs, work in a Chinese restaurant. They have to fry the food, and they're standing very near to the oven. Their sperms are less than before. Right. So it's not only cycling; it's anything that increases the temperature of the testes for a long time may cause problems.
And I'm sure you get this question a lot. Handphones in the pocket.
Handphones in the pocket. If you don't use it, then the temperature is lower down. It's not that warm unless you use the phone a lot and it warms up. Now the issue of handphone is the fear of radio frequency, whether it affects the sperm testis or not, the testis as well as function or not. A lot of studies have been done whether does it cause radiation, does it cause tumor in the brain. So there is no solid proof that using handphones you may cause sperm to go down. But this type of studies are what we call epidemiological studies. They have to look at 1,000 men who put their handphone in their pocket, and they have to compare with 1,000 men who put their handphone in their front pocket or a pouch somewhere further away from the testis. Then only we can draw a conclusion. So these studies are not easy to perform. Of course, try to limit putting a lot of electronic items near your body. That would be the best.
We've talked a bit about hormones just now. What about hormone disruptors? Are there any things that we should avoid?
Okay, hormone disruptors are chemicals that exist either from nature or because of industrial age, artificial chemicals that mimics the hormones that we have in the body. So we get it a lot, for example, in plastic containers. I think maybe about a few years ago there was a lot of issues on BPA, bisphenol A. So any plastic containers, they will have some chemicals. So it depends on the grade of the plastic. If it's a very cheaply produced grade and you store your food in it, so some of the food, when it touches the plastic container, the chemical will leach into the food and then you consume it. Of course, the better grade quality, the less of this happening, but the risk is still there. Especially if you put hot food inside, that will hasten all the chemical processes. So our government did a good job in banning styrofoams. a couple of years ago, which is good. Styrofoam, you put your hot food, your piping hot food inside the styrofoam. So all sorts of chemicals are leaking and you're ingesting into the body. So anything with food, the best container to use if you like to bring food back home would be glass container or stainless steel. So those will be inert and doesn't cause any chemical reaction. The other possible source of chemicals would be if you work in the agricultural sector, like pesticides, chemicals, fertilizers. So all of them have some chemicals. So if you work in that industry, then it's very important that you wear enough protection from those chemicals. After you get back from work, you make sure you have a shower, wash your hands properly, wash everything off the chemicals off your body, from your hair. So same thing also in manufacturing. You work in a factory and they use a lot of plastics, electronic items, a lot of the solvents in the production of microboard and all the chips. Okay, all of them are chemicals, and all the chemicals, they may seep through your skin or they may get on your hand, and when you eat your food, you may consume it into the belly. So those are the things we need to look out for.
Just going back a little bit about getting checked, having this conversation with someone the other day, and are men forthcoming to coming for all these checks? Do you find it that there's difficulty in men coming forward to get checked?
Oh yeah, definitely.
Why do you think that is?
I would say it's more of the ego of the Asian males. I think not only males, but most Asian males have a bit of this thing. For a long time, for a couple of thousand years, a lot of fertility problems have been blamed solely on the female side, which is unfortunate. So I think nowadays, of course, with more knowledge and more understanding, males, they will slowly realize that there are some issues in themselves. But of course, the first thing is whether the male partner acknowledges this fact or not. The second thing is, of course, convincing the male partner to come forward and get tested. It's a bit sad because the first step to check the sperms is actually very simple. Okay, just give a sample in a small container, and within 1 hour or so, then we'll have a result. As opposed to ladies, if they want to check why they are not getting pregnant, it's much more complicated. They have to do scans, they have to do blood tests. They have to do a special procedure to test whether the tubes are blocked or not, which is very uncomfortable and takes a long time. Whereas the sperm test is 5 minutes, just deposit the sperms and that's it. So I have couples coming, or maybe just the ladies coming, and I don't see the husbands. Maybe the husband comes the first visit, then the rest of the time the husband is nowhere to be found. A bit unfortunate.
Alright, so guys, if you and your partner are having fertility issues, go and get your sperm checked to find out what's preventing you from having a baby. As Dr. Chong mentioned earlier, it will take just 5 minutes to drop off your sperm. If you're all good, then the doctor can focus on your spouse. Dr. Chong also mentioned that the tests that the woman will have to go through are a lot and can sometimes be painful. So guys, man up and let's get checked, right? Now, Dr. Chong, before I let you go, what would be your advice for men who want to be fathers?
So the first thing, of course, to take care of your health. Okay, look at your lifestyle. If you smoke, drink alcohol, of course, please cut down. If you're overweight or you don't exercise much, it's time to get more active. You don't have to join the gym. Just exercise 2 or 3 times a day. Just walk around the park. The number 3, of course, is don't be shy. Get yourself tested. The sperm test is not a painful procedure, so it's very fast, it's very quick and easy, and of course, it's being a male, you have to take charge of the fertility problems. As you said, man up and confront your own fertility issues.
All right, great. Thank you so much, Dr. Chong, for being on the show and enlightening us with this situation and what we can do to fix it.
Yep, thanks for having me, Kevin.
That was Dr. Chong Kuoh Ren, gynecologist and fertility doctor. Like Dr. Chong said, it's time for us to man up and get checked. To encourage you, we have a health pledge at manupmalaysia.com. Download the pledge and commit to getting your sperm checked, or at least commit to doing something to improve your health, especially if you have infertility problems. More details at manupmalaysia.com. But for right now, if you liked this video and all the information that we've discussed with Dr. Chong, then like it, share it, and of course, do subscribe to this channel. I'm Kevin Francis for Man Up Malaysia, helping men get healthier one pledge at a time. See you in the next episode.